Howdy, y'all. I'm Dr. Jarvis, and we're going to do another episode of EMS Talks. Today we have Dr. Caldera. He is an interventional cardiologist at Scott & White Round Rock, and we're going to talk about a couple different topics. We're going to start off primarily talking about congestive heart failure. So this is a really great opportunity for me, and it's an exciting thing to be able to talk with Dr. Caldera. We have worked very well together for the past 6-7 years now. Here at Scott & White, and he is a wonderful partner for EMS. He's been very helpful for us and very helpful for me as an emergency physician. So this is a great opportunity for all of us, and it's going to be a lot of fun, I think.
Thank you, Jeff. Appreciate it.
Dr. Caldera, would you like to just say hi and give us a brief background on who you are?
Well, it's good to be here. I am an interventional cardiology, also a general cardiologist, and we started our STEMI program here and have been working together with the Williamson County EMS for about 6 years now. And it has been a great experience, and I think that we have learned from each other tremendously, and I guess this is the idea of the interview today, to continue to learn. So.
Absolutely. So we're going to be talking to our first responders, as well as our 911 paramedics and our community health paramedics, our CHIP folks.
Great.
So let's talk a little bit about congestive heart failure. If you don't mind, can you give us sort of the 10,000-foot overview of what congestive heart failure is and why we care about it?
So congestive heart failure is a clinical condition due to an increased pressure in the heart. So when the heart is unable to manage the pressure properly, and it's increased inside of the heart, it will lead into either pulmonary congestion or to fluid buildup or edema in the periphery, lower extremity edema or ascites, fluid in the abdomen. And the common denominator is that there is a situation where the pressure within the heart is increased. This could be due to weakness in the heart muscle, which is systolic dysfunction, or it could just be due to a stiffness in the heart muscle. And even though the strength of the heart muscle, moving the blood forward is appropriate, accommodating the blood that comes back is inappropriate, and that causes elevation in the pressure and therefore pulmonary edema and shortness of breath or lower extremity edema. It's a common condition that is the end result of many cardiac situations. A hypertensive heart disease may lead to this. Coronary artery disease may lead to this. Sarcoidosis may lead to this. Infiltrated disease as amyloidosis may lead to this. There are some congenital cardiomyopathies, different types of fibromuscular dysplasia. So there are many, many etiologies, but the common denominator is that there is an increased pressure within the heart.
Now, is there what types of patients do you expect to see CHF in? What are the risk factors?
So when you look at the general population, heart failure is more predominant when you become older, because chances are that you had hypertension for a longer time when you are older, so your heart may have become stiff and you may have developed the diastolic heart failure. But also, if you develop coronary artery disease, if you have high cholesterol, if you are a smoker, if you have family history of blockages in the arteries to the heart, and now you're having lack of blood supply into the heart, this is also causing problems in the contractility and in the relaxing properties of the heart, and it may lead to either weakness or stiffness in the heart muscle, which is the cause of the congestive heart failure. So when the older you get, the better chance that you have of having it. If you are obese and then that leads to diabetes, high cholesterol and hypertension and coronary artery disease, then the chances of having heart failure are bigger. As I said before, it runs in certain families, so even young people could have it. Certain congenital heart disease where there are abnormal communications within the heart could lead into the same increased pressure in the heart that is what we know as congestive heart failure.
Are there any infectious etiologies of it?
Yeah, certainly. So in the underdeveloped countries, there is, particularly in South America, Chagas disease is a very common cause of congestive heart failure. HIV could affect directly the heart. Certain viruses could affect the heart. Luckily, most of the viral infections into the heart are transient, and most of patients that suffer of an acute weakness in the heart muscle due to a viral disease recover from it. And although occasionally you have some patients that will continue to have chronic congestive heart failure, but they may have had a genetical predisposition to do this. Rheumatic fever, which is an autoimmune reaction to a bacterial process, could cause injury into the heart muscle directly and into the heart valves, and it may lead to congestive heart failure. So among the infectious etiologies, you have to think in viral, rheumatic fever, and in the underdeveloped countries, Chagas disease. It's important to keep that in mind since we, sometimes take care of patients that come from other places. So
we've had, actually one of my best friends had a bulldog that had Chagas disease. He ended up with a little veterinary pacemaker for Chagas disease.
Yeah.
So the rheumatic heart disease. So in the emergency department and in primary care situations, we see a lot of people who are concerned about strep throat, and sort of the expectation is that they're going to be put on antibiotics if they truly have strep throat. I think the common understanding is that we're treating the strep throat with the antibiotics. It's sort of a fascinating thing when I actually learned that the reason I've been prescribing penicillin has nothing to do with the strep throat. It has to do with the downstream complications, the rheumatic heart disease.
So the issue with rheumatic heart disease was when these infections were not treated properly and the body was exposed to these antigens for many months, it will lead into an autoimmune reaction. So now perhaps there is actually abuse in antibiotics that brings other issues like bacterial resistance to antibiotics and so on. But when it comes to rheumatic fever, we have seen a significant decline in the incidence of the disease because we get rid of the strep efficiently.